this video, I'll show you why squats cause knee pain and what you can adjust to keep training. Let's get right into it. The first point is load and volume tolerance. Knee pain during squats often shows up when total workload exceeds, or total workload and volume exceeds what the knee can tolerate. So heavy loads or high intensity squatting very frequently, or even high volumes of squatting and squat sessions throughout the week can overload the tendons in the knee joint way more than it can recover from. So one solution that I commonly use with my clients is just to reduce the total sets or even the frequency that they're squatting. So the simple solution would be to start off a training cycle with just 2 sets instead of doing 3 sets. And then you can build from there. Or if you're already doing a lot of squat volume, just cut out one day. If you're training squats 2 times a week, cut out one of those days and just substitute maybe bending patterns or even just no lower body movements whatsoever for that whole entire day. This will allow you to build back up that tolerance over time instead of completely eliminating squats altogether. So you still get that training effect without putting excessive stress on the knee and allow it to heal and recover. So the second point is poor hip mobility, specifically hip internal and external rotation. When you lack hip internal and external rotation, specifically in the bottom of the squat, that's going to place excessive strain on that knee joint. So that knee starts to move even more than it normally should move during the squat. This places excessive stress, excessive load, excessive torque that's going through that knee. And if you continue to do that over and over again through multiple reps, multiple sets, and multiple sessions, then that starts to irritate that knee even more than what we would like normally. So this is all about adjustments. It's not about actually fixing it. Obviously, the fix is improving your hip internal and external rotation. But what can you do while you're working on that? So a simple solution is to reduce the range of motion required for that specific squat pattern. So you can do this by performing box squats, which doesn't require as much hip internal and external rotation like a deep squat would, a deep squat would. So you do box squats while you're working on your hip range of motion. You could also do pause squats. So you can just pause at parallel and then come back up from the parallel position. So you just reduce the overall range of motion that's required during that squat pattern. And then you can also do different movement variations. So you can do a trap bar deadlift. It's not necessarily a squat, but you can still train your legs doing that movement and it doesn't require as much range of motion. So the third point is the tempo and the control. So when you are moving through your squats very fast, let's just say you're going, I call it dive bombing into the bottom of a squat. You're using more so a stretch reflex instead of actual muscle control and contraction. Now, if your knee is irritated, it may not be able to tolerate that stretch reflex. So what you will want to do is slow down that squat by performing maybe a 3-second lower and then a 2-second ascent. So that lower is going to allow you to control, 1, your hip muscles to engage how they should, 2, learn the pattern a little bit better, and 3, allow for proper knee alignment, proper knee tracking during that movement, preventing that excessive knee motion that may happen when you perform a rapid moving squat pattern that requires a stretch reflex. And the fourth point is lack of lateral hip endurance. So we're talking about specifically the glute medius and the glute minimus. So when those muscles aren't doing their job appropriately or they fatigue out, then the knee can start to drift inward or the knee motion just starts to track a little off. And that just puts more stress on the knee. So what we will want to do for this is to perform more single leg exercises. The reason why is because that's going to put more stress and emphasize more lateral hip control and endurance during the movement. So one of my favorites is a back rack reverse lunge. Why? Because it translates over into the squat really good because it simulates that same positioning. It may not be as deep as a squat would be, but it still simulates that position and it increases the endurance of the lateral hip muscles a lot more than if we were just performing the squats themselves. And the fifth and final point is lack of or limited ankle mobility. When you lack ankle mobility, your knee is going to try and track in whatever way it can in order to get into a deep squat. Now, this can show up in the back, but specifically for the knee, it's going to track probably inward in order to move around that limited ankle mobility that you have. And again, this offsets that knee tracking, putting more stress on that knee joint. And as you continue to do more repetitions, the knee can become irritated. So while you're working on your ankle mobility, you want to perform movement modifications such as a cyclist squat. A cyclist squat elevates the heels and still gets a lot of quad contraction. So that way you can still train your quads and not worry about so much knee stress when you're going into your squat patterns. Another thing you can do is to perform a box squat. A box squat doesn't require as much ankle mobility, the same thing as we talked about for the hip mobility. So you can perform these two different variations while you work on improving your ankle mobility. So knee pain doesn't necessarily mean you have to stop squatting. It just means you need to change up the dosage or you need to modify some movements while you work on whatever limitation you specifically have. And if you want help applying any of these strategies to your training, you can book a free call by going to the link in the description. This isn't a sales call. This is a call to help you move forward through or work around what you have going on right now in your training. Thanks for watching, and I'll see you in the next one.